asi muongororo yatakaita takaona kuti zviri nani kuti tinonoke tichigadzira mutemo unoseenzeka zvakanaka pane kuti tigadzire zvinozotitemesa musoro wakanyanya. Saka pakadzorerwa magwaro tine shungu yekuti patinozosvika pakota inotevera mapepa anenge apera zvouya, asi hatisi kunyanyisa kukoshesa kumhanya, tiri kukoshesa kuti tinge tine mutemo unoita kuti basa rifambe zvakanaka tichienda mberi. Nekuti pari zvino Minister veLocal Government naMinister weFinance vari kuendesa mari dzinosungirwa kunge dzichienda dzekuti matunhu anga achiita. Saka hakuna hako dunhu riri kusaririra mashure zvakanyanya maringe nekuti nebasa riri kuitwa rakananga devolution. Chatiri kukoshesa ndechekuti tinge tichiwirirana kuti mutemo uyu unotibatsira, tisingakoshese kuti munhu anzi ari pabasa asi mutemo uchimusunga kuti asanyatsoita basa zvakanaka. Tinotenda.
Supplementary, Honorable
Karenyi.
Yes, Honorable Karenyi.
Mazvita, Mr. Speaker, say mubvunzo wangu wekuwedzerera Mr. Speaker unoti izvi zvarakidza kuti sehurumende hatisati takwanisa kuti zvinhu izvi zviendeke, nekuti pfungwa dzangu nekuziva kwangu mu9th Parliament vanhu ivava vakavhoterwazve vakanzi vave vari maprovincial councillors, temu ikapera, iko zvino vovhoterwazve temu yavo yaakutopera. Mr. Speaker, kana zvichireva hazvo kuti hurumende yazvitadza, zvakadii Mr. Speaker kuti zvichitaurwa pachena kuti vanhu vasatambisawo nguva dzavo dzekukwikwidza, nekuti mukukwikwidza munobudisa mari. Mr. Speaker, vanhu ava vachingova netarisiro pasina chinobuda. Saka mubvunzo wangu kuna Honorable Minister ndewekuti hongu mataura kuti zviri kuitwa manje manje zvingada makore mangani, nekuti pari zvino makore akutosvika makumi, tinoti 5+5 zvoreva kuti 10. Mr. Speaker, vanhu havasati vauya. Pane here zvavachazonzi vazopiwa zvinova maringe nekuti vaifanira kuwanei pamwedzi kwavari ikoko kumaprovincial councillors kwavo? Mazvita vamwe vakatodzingwa mabasa Mr. Speaker nekuti pavakaunza maCV avo vakabva varizaina kwavanga vari, izvozvi mabasa havana. Saka vanoitwawo sei nekuti basa rake munhu iyeye rinenge rapera? Mazvita, Mr. Speaker.
The Honorable Minister.
Ndinotenda mubato wechigaro. Mubato wechigaro, basa rekugadzira mutemo riri kuitwa. Parinenge rapera tichakupai magwaro acho kuti mugazeti zvouya muno kuti tidhibheti. Chatisina kungoita chete ndechekuti timhanye tiuye nezvinhu zvinenge zvichiratidza kuti pane kukwikwidzana nekusadyidzana kwakanaka pakati pemakanzuru. Saka ndo zvatakati ngazvikwenenzverwe. Kana zvapera tichauya nazvo. Chatakangoona kuti hatigone kunyanyisa kuita ndechekuti timhanyise avo vanotinyorera mutemo, ivo vakumbira nguva yekuti vari kuda kuti vambonzvera zvakanaka kuti vabude nemagwaro akanaka. Havana kutadza, asi dambudziko nderekuti seZimbabwe patakaita constitution tine zvinhu zvakawanda zvatakakopa-kopa tikabva tabatanidza zvatakuda kuti tipenengure tione kuti kune dzimwe nyika dzacho dzine hwaro ihwohwo hwemaprovincial council vanozvifambisa sei tichifananidza nezvatiri isu senyika. Ndinotenda mubato wechigaro.
Honorable
Madziwanyika.
Madziwanyika, yes, please take the floor.
Ndatenda mubato wechigaro. Tinotenda nemhinduro yakwana negurukota. Mubvunzo wangu wekuwedzera gurukota ndokuti hazvigone here kuti iko zvino takambomirira here mutemo uchauya, hazvigone here tigadzire umwe urongwa hwekuti vafanira kushanda basa mutemo chaiwo uchizouya. Izvi zvinotibatsira Mr. Speaker kuti basa redu kumatunhu rifambe zvakanaka sekuti vakuita bumbiro renyika yedu. Ndatenda Mr. Speaker.
The Honorable Minister.
Ndinotenda mubati wechigaro, ndichitenda Honorable nezvimhinga mupinyu zvavari kuti zviri kutadzisa basa kufamba. Izvo ndofunga kuti kana pane zvavaona zviri kuitika kumakanzuro edu zvisiri kunyatsofamba, vakaudza minista welocal government vanogona kutibatsira kana vaona kuti pane zvisiri kufamba sematauriro avaita, kuti toona kuti zvogadzirwa sei kuti zvinge zvichifamba.
On a point of order, Mr. Speaker.
I beg your pardon?
On a point of order.
There is no point of order.
I thought it arose from the response by the Honorable Minister.
No, there is no point of order.
Maybe a point of clarification.
Yes, point of clarification.
Okay, Mr. Speaker, senatenda. Ndaona kuti mhinduro yabva kuna minister yanga isina kunangana nomubvunzo wandanga ndabvunza. Mubvunzo wangu wanga uri kuti hazvigone here paite umwe urongwa huripo hwechimbi chimbi hwekuti basa rifanira kuitwa haro mutemo chaiwo uchizouya.
Mazvita.
Ndatenda.
The Honorable Minister.
Ndinotenda mubati wechigaro kuti tiite mutemo wechimbi chimbi panenge pane vende risingagone kugadzirika pasina kuiswa mutemo. Saka ndati kana vane vende ravaona riripo rakakosha zvakanyanyisa zvekuti ministry yelocal government haigoni kurigadzira rinoda mutemo, vakaenda kuna minista vanouya kwetiri kuti paita zivendera hatichagona kuambuka Rwizi, todii kuti tiambuke totsvaga chibridge chavari kuda ichocho. Saka ndo zvandada pindura mubati wechigaro. Tinotenda.
Honorable Mazivaini, uyai nazvo. Honorable Bajira. The Honorable Bajira.
Yes, Mr. Speaker, thank you for the opportunity. My question goes to the Minister of Veterans of the Liberation Struggle. Government has conducted vetting programs in 2022 and in 2024, and to date, we would like to know from the Ministry the pace and the stages that they are taking towards gazetting the names of those who have been vetted and approved to fall into one category or another of the veterans of the liberation struggle. I thank you.
The Honorable Minister.
Thank you, Mr. Speaker. I want to thank the honorable member for that very important questions about our veterans. Actually, Mr. Speaker, today the Minister of War Veterans was actually thanking Treasury that process is almost complete. So we should be able to see a gazette soon because that process has been finalized. Treasury has committed funds to ensure that that process is done, and the Minister of War Veterans indicated so this morning in our meeting. I submit, Honorable Speaker.
Thank you. I don't see any supplementary question. Honorable S. Chuma. Honorable S. Chuma.
Maita basa mubati wechigaro. Mubvunzo wangu unoenda kuna Minister of Land. Regai nditange nekutenda mutungamiri wenyika yedu President Dr. Emerson Dambudzo Mnangagwa nechirongwa chavakaparura che-presidential borehole drilling scheme. Mr. Speaker, chirongwa ichi changa chichifambawo zvakanaka, asi tiri kuona sokuti iko zvino chaita sokuti chamira kubva mugore rakapera kusvika izvezvi. Takatarisa kuti mwaka wemvura wakuswedera kunzvimbo kuma-constituencies ari kumaruzevha kumamisha ndonguva yatinenge tichitarisirawo kuti kutange kudhiriliwawo kana kuboorwa zvibhorani zvinozobatsirawo vanhu. Saka ndiri kuda kunzwa kuna minista kuti matanho api avari kutora kuti vazadzise dzimwe nzvimbo dzavakaenda vachipegesa zvibhorani izvi kuti zvichauya zvocherwa pava nenguva zvisati zvacherwa apa nguva yafamba, kuti zvingaitikawo rini kuti chirongwa ichi chifambe nenguva sekutaurwa zvakaitwa nemutungamiri wenyika Maita Basa.
The Honorable Minister.
Ndinotenda mubati wechigaro ndichitenda nemubvunzo wabvunzwa naHonorable Chuma kuti chirongwa chakaisvonaka chaPresident chemabhoho chinenge chisiri kufamba nenhano dzachaifamba nacho pakutanga. Mubati wechigaro ichokwadi kuti zviri kutaurwa naHonorable Chuma. Honorable Speaker, nhengo dziri muno mahonorables vanorangarira kuti gore rino tine zvimhingamupinyi zvakawanda zvakabata nyika. Senyika inowana mari yayo kuburikidza nemataxes nemaroyalty nezvimwe tisina kwatinogona kunge tichikwereta kuti tinge tichiita anonzi muchirungu long term projects, pakangovhiringika kunze kwenyika kune kudyidzana kunoitika zvinotadzisa kuti marongero atinenge takaita anga achifamba zvakanaka. Pakatanga hondo dzekurwa kunze kwenyika, mapuraizi ezvinhu akakwira zvakanyanya, ndobva taudzwa nevanoongorora zvakare zvekunze kwenyika kuti gore rino ratakupinda iri mvura ichange isinganaye zvakanaka kune El Nino, zvakakonzera kuti mitengo chaiyo yepafertilizer kune varimi vakaona kuti yakakwira zvakanyanya. Saka pfungwa dzedu nezvimwe zvese takabva tati ngatisapotei kana kuti tibatsire veministry weagriculture kuti gore rino titenge chibage chakati wandei kudarika makore ese, nekuti takatarisana nenzara pamberi avo. Inove kurudziro yakaudzwa yatakapiwa naPresident kuti chero isuma nhengo dzedare reparamende patinoenda tisingavhundutsire vanhu, ngatingoti takagara tiri kudzimamisha kuti gore rino ngatichengetei chibawe mumatura edu, nekuti kungangoita nzara tisingavhundutsire hedu tichingovaudza kuti vari kutiudza vari kuti kungangoita nzara. Ndo zvatiri kuitawo mubati wechigaro. Asi zvikati dzikamei, shungu yedu takatarisa vision yaPresident ndeyekuti every village among our 35,000 villages inge ine borehole ne-village business unit. Ndo zvatiri kuramba tichiita, asi apa tangozungunutswa nekuti pane zvatiri kuona zvatiri kuti tinge tagadzirisa kuti mhuri zhinji yeZimbabwe isafe nenzara, tirambe tichifamba takabatana tese tiri pamwe chete. Tinotenda mubati wechigaro.
Supplementary, Honorable Estrom.
Maita Basa mubati wechigaro. Ichokwadi ndinotenda nemhinduro yataurwa naHonorable Minister. Sekutaura kwavari kuita kuti gore mwaka watiri kubata uyu unotarisirwa kuti mvura inenge isinganayi zvakanaka. Tinobva taona zvekare kukosha kwezvibhorani izvezvi munzvimbo dzatinobva nekuda kwezvipfuyo zvine vanhu kumusha, nekuda kwemagadheni mabindu iwawo ari kubatsirikidza zvekare kuti vanhu vawane chouwiri chokubata. asi zvisinei mhinduro yavo tainzwa. Mubvunzo wangu kuwedzera ndoti, Honorable Minister, pamunoshedzera kuti nyoresai maconstituency yoga yoga zvibhorani zvishanu zvinouya, touya tomhanya tonyoresa, vanhu vanouya, vaya vanouya vachipega voenda vonopega, isu tobva tashedzerawo kuti hurumende yati izvi zviri kuitwa. Saka pazvinoregedzwa kuitwa paya, tinosara taakusangana nemibvunzo isu sevamiriri vevanhu vachitibvunza kuti ko zvamakati, asi tinenge tisina mhinduro. Saka tatichikumbirawo kuti pamunodeedzera paya kuda kana zvaibvira tikadeedzera zvepadiki zvatinogona kuita nenguva pfupi pane kudeedzera zvemberi, nokuti zvaakutinetsesawo kwatinobva, asi mhinduro yenyu ndainzwa.
The Honorable Minister.
Ndinotenda mubati wechigaro. Vari kungopanga mazano avo havana mubvunzo kuti pakushanda tinge tichitaura taapedyo kusvika, tisaridze huwi, tiri kure, hapana anoinzwa. Taanzwa mashoko mubati wechigaro. Tinotenda.
Salvendari.
Yes, Honorable Maziwaiga.
Thank you, Mr. Speaker. I wish to thank the response given by the Honorable Minister. My follow-up question, Honorable Speaker, relates to the fact that some of the balls have been budgeted for in our 2026 year budget, and we approved it as Parliament. For the second quarter, Mr. Speaker said, Zimura has surpassed its own target and the government, the Ministry of Finance target, which means we've got sufficient resources for those balls which have been budgeted by government. Where are we with those balls which have been budgeted, yet the resources are available? I thank you, Mr. Speaker, sir.
Honorable Minister.
Thank you, Mr. Speaker. Sir, I want to thank the honorable member for his question, where he speaks about the impressive results by Zimra to be able to collect and surpass a target. Mr. Speaker, sir, some of the issues that I spoke about that we need long-term planning now cannot wait for collections that will be done within the third and fourth quarter. So what he's speaking to, we are very much aware of that, but there are certain exigencies that needed us to divert funding to ensure that as a country we secure sufficient grain as a country. Because of the wars in the Middle East, we also secure fertilizers to ensure that we can grow our crops, and that cannot wait for collections that we will do in the third and fourth quarter. I submit, Mr. Speaker.
Honorable Medal. I don't see you properly there. Honorable
Spanda, MC.
Yes, please. Honorable Spanda, proceed.
Yes, thank you. I want to thank the Minister for the explanation on the presidential ball. My follow-up question is on the issue of monitoring and evaluation of these presidential projects. Is there a program that then follows in terms of monitoring? Because where we come from, sometimes we realize that some of these projects, communities have been shortchanged. The balls, maybe it's just the drilling, yet in other places there is drilling, installation, and the people can access water. So my follow-up question is to say, is there specific monitoring and evaluation of this presidential ball scheme? I thank you.
Very much. The Honorable Minister.
Thank you, Mr. Speaker. The answer is yes. We actually have a Ministry of Presidential Affairs. We have a special advisor to the President responsible for monitoring and evaluation of all those special projects. I'm sure, Mr. Speaker, honorable members have seen him touring the country, assessing the projects. He works with a team, he produces a compendium of all the projects that are being done. And if those projects, I will then check with his office for copies to be distributed to honorable members so that they can be aware of some of the projects that are being done. The office actually does a very wonderful work of monitoring and evaluating the work that is being done. I submit, Mr. Speaker.
Point of privilege, Honorable Speaker.
Pardon?
Point of privilege.
Now ask your supplementary question.
Supplementary? No, it's not a supplementary.
Can you ask your supplementary question?
Thank you very much, Honorable Speaker.
I recognize the honorable.
Okay.
That's Honorable.
Mambi Piri.
Pardon?
Mambi Piri.
Yes, please proceed.
Thank you very much, Mr. Speaker. I appreciate the response by the Minister that given the circumstances and the context, that to divert funding in order to prepare for a looming disaster or so forth. I just want to ask the Honorable Minister whether this is tantamount to rewriting the budget that we approved in this House. And if so, is that allowable for you to take that stance of rewriting a budget that was approved in order to prepare for something in the future? I think.
The Honorable Minister.
Thank you, Mr. Speaker. The short answer is we are not rewriting the budget, and the other answer is it's within the budget. I submit.
Yes, thank you, Honorable Speaker. Tine nyaya yatatambira Honorable Speaker yandechida kuti mutibatsire. Tine nhengo dzedu mbiri dzeparliament dzasangana nedambudziko pavanga vari kuita basa reparliament, vasangana nekurohwa, but zvaitika vari vasangana nedambudziko vanoti Honorable Chimbaira naHonorable Mavudzi varohwa vari pabasa reparliament. So kwaMutare today Honorable Mavudzi ndo vati kwarei. So ndareza nyaya iyi Honorable Speaker kuti sevanhu vanoremekedzwa nhengo dzedare reparliament tinofanira kuti patine tichiita basa tigone takachengetedzeka, asi tanga tiri kukumbirawo mubato wechigaro kuti since zvaitika pagovernment complex, maybe mimi Mr. Speaker mutibatsire kuti panyatsowanikwa ndingati ongororo, then kana paine report ingagonewo kuuya mukati medare reparliament toionawo isu senhengo dzedare.
Order. That's an administrative issue that should be brought to my attention. Why are you screaming? If I am informed, I have to take appropriate action. If I am presiding here, how do you want me to take appropriate action? We have an office here. Report immediately. Then appropriate action will be taken. Honorable Tiungwe.
Maita basa, Honorable Speaker, sir. Mvunzo wangu unoenda ku Ministry of Agriculture. Tinoda kutanga kutenda mwaka winter wheat wakafamba zvakanaka, takaona gorosi rakazara chaizvo irrigation. Mvunzo wangu woti tava pari pakugadzirira summer irrigation uye ne whole season zvayo, kuti neseason yacho yese kuti tinge tichiwana ma-inputs kubva kumbeu, fertilizer nezvimwe zvakadaro mwaka wechirimo. Tatenda.
Minister.
Tinotenda mubato wechigaro, tichitenda nemubvunzo wekuti tave papi kugadzirira kurima kwapedyo kuuya, zvara kuda kutanga. Mubato wechigaro pandambenge ndichitaura Honorable Chuma vabvunza yemabhoho, ndapindura ndikati tamushishi yekutsvaga mafertilizer. Dambudziko ratinaro nderekuti nengari yekusagadzikana kwanga kwakaita kunyika dzekumabvazuva, mafertilizer acho anga achinetsa uye achidhura, asi Ministry of Finance yakaendesa mari kuMinistry yeAgriculture kuti mafertilizer nembeu zvinge zvichiunganidzwa. Tiri mushishi zvakare kuti nengari yekuti muongororo nekufundiswa kwatiri kuitwa nana mazvikokota tiri kuudzwa kunzi mvura ichati naye shoma, asi tisinganyatsoziva kuti inenge ichinaya munzvimbo zvakaita sei. Saka iye zvino zvakare tiri kuda kuti tichisenza nebandiko redu reADA tinge tichitsvaga mbesa nemafertilizer toita madiridziro pane imwe minda yatinoziva kuti tikange tarima minda iyoyo tinokuwana goho rinoita kuti senyika chero tikange tati vanhu muite mabindu enyu tinenge tine kwekuti tinenge tagadzira kadura kedu sehurumende. Asi vimbiso yandinopa ndeyekuti hurumende iri mushishi rekuunganidza izvo zvinoita kuti vanhu vange vachirima, asi basa hombe rataakuita nderekuti tinge tichiita kuti tive nemadiridziro kuADA anoita kuti tigogona kukohwa zvakakwana zvinoita kuti kana zvimwe zvikatsva izvi tinoenda tinotora mudura renyika raPresident. Tinotenda mubati wechigaro.
I do not see a request for a supplementary. We proceed. Honorable Dean Kala.
Thank you, Mr. Speaker. My question is directed to the Minister of Tourism and Hospitality Industry. What policy measures does the ministry, in collaboration with other ministries, have regarding the issue of street kids that are running around the tourist attractions or tourist facilities like the hotels and creating havoc, stealing purses, wigs and other personal belongings of these people? We have had an incident where an honorable member has lost a wig to these rogue people.
The Honorable Minister of Justice.
Thank you, Mr. Speaker, sir. Mr. Speaker, sir, that's a law and order question where the respective hotels and the respective commanders, in terms of our police commanders within that area, if they are informed, they can intensify surveillance and ensure that they deal with those issues. I believe that thieving, I'm not sure whether it was a street kid, because if it was a street kid, the honorable member is assuming that he was caught and identified as a street kid. But a question of law and order requires that those responsible authorities should then engage our police commanders within their respective areas so that they can map up a strategy to ensure that our visitors, our citizens go about their duties without fear. I submit, Mr. Speaker.
Thank you. I do not see any supplementary question. Honorable Munemo. Honorable Munemo.
Maita basa mubati wechigaro. Mubvunzo wangu unoenda kune mubati webazi reutano. Tine zvipatara kana tatingati makliniki wari kumaruwa kwokupedzisira chaiko. Urongwa hupi hwava nahwo wokutiwo kunyangwe variko ikoko kana vakaita yatingati emergency yemaaccident kana anenge aitika kana varwere vari serious vanogona kuti vabatwe. Ndichitaurira panhau yemasaisai avako ari kupiwawo muzvikoro, hapana here zvavava nazvo paurongwa hwavo kuti kuzvipatara ikoko zviitwewo saizvozvo. Tinotenda.
Honorable Minister of Health.
Tinotenda Honorable Speaker. Ndoda kutendawo zvakare Honorable nemubvunzo wavo. Tine urongwa hwakati kurei watiri kuita nokuti tinoti hapana nzvimbo inofanirwa kusaririra. Chekutonga ndoda kuzivisa dare kuti makliniki mazhinji edu tiri kuenda tichiisa solar power kuti kurambe kuine kuchikwanisa kubatika nevanhu vari ikoko vachiona. Tane makliniki akawanda anopfuura 400 ataisa masaisai eStarlink kuitira kuti tikwanise kutaura nevanhu vari ikoko. Tisanganisa zvakare nekurapa kwatinoti telemedicine kuti tikwanise kunge tichikwanisa kubata vari ikoko. Chatakatanga chiri pamberi isola kuitira kuti wo patinoisa Starlink tinoisa panenge pane magetsi kuitira zvienderane. Saka chirongwa ichi chiri kuenderera mberi. Chandisingakwanise kutaura ndechekuti tinenge tapedza rini makliniki edu ose, nokuti aripo ezvinezvi anosvika about 2700 atinofanira kuti tiise masaisai iwaya zvigokwanisa kuendeka zvakanaka. Mazvita.
Supplementary. Yes, that's Honorable.
Honorable
Gwangwara.
Mwapona vyeni vasichuno twalumba mubuzi wangu ulogu ya uli minister bazwa mukwambula pa Ministry of Health. Bantu bayingi muzibadera bakapegwa wangu bati ma Starlinks balogu duwega kujana mali njotulo kuti mali ya ma subscription ama Starlink zibadera zingiroko tabasuku konzi yape kuti bajane mali ya utabereke ake mukuchengetwa kupera tasukubereka pe balogu chita biyeni kuti kujanike mali ya kuti ma Starlink ajane ma subscription dalumba logo.
The Honorable Minister, you come from a province where the language is spoken. I'm sure you followed.
Palumba, Honorable Speaker. Mr. Speaker, sir, I want to thank the Honorable Minister for that supplementary question. Honorable Member, indeed, we have received those challenges and we are engaging the agent to lower the subscriptions so that we are able to pay for all those Starlink kits that we will install. I think the negotiations are taking place because we understand they had been a bit too high for all our clinics, and it was also too high for us as a ministry to be able to pay the subscriptions. So negotiations are taking place. Thank you, Mr. Speaker, sir.
Supplementary? Yes, Honorable Engineer Mwagwa.
Thank you, Mr. Speaker, sir. Considering that the telecommunications bill is still before Parliament, is it not prudent that such costs are taken through the USF or the Universal Service Fund so that libraries, hospitals, and other essentials are treated the same way that we do with the establishment of base stations in remote areas?
The Honorable Minister.
Thank you, Mr. Speaker, sir. I think Honorable Member has come up with a suggestion, but with your permission, if I can allow the ICT Minister maybe to assist in answering that question. Thank you.
Permission granted, Honorable Minister Mabetela.
Thank you very much.
Mr. Speaker, sir, allow me to thank the honourable member for that question, and also the honourable Minister for Health who also forwarded that question to me. Yes, indeed, within the Universal Services Fund, we have made a provision to pay for subscriptions. But because of limited resources, where we are paying for subscriptions is mainly for our digital centers, and secondly, at various schools. But this is only for a year. So we would expect within the community people to then come up with a sustainability plan which will make us be able to pay for the various subscriptions. But like what you suggested that maybe we also need to do the same for hospitals, which I think is worth considering. We'll communicate with the Minister of Health and find out a way that we can, for us to also give a provision for subscriptions for our hospitals, because currently the scope is mainly for our digital centers and schools. So I'm sure it's important that we would also extend that to the hospitals as you have suggested. I shall submit. Thank you.
Thank you. Supplementary.
Thank you, Honourable Minister. Yes, supplementary, Honourable Matangila.
Thank you very much, Honourable Speaker. My supplementary question is, no further schools at times of 400 mechanical uya, masola achuya. Si, vabereki kumusha kumaruwa. Panga pachidiwa chichipatara vakaforma zvidhina vakavaka makliniki akapendwa akapera. Urongwa hupi hune hurumende kuti uye izobatsira vanhu ivavo vane chido chakadaro kuisa mafloors tovakawo dzimba dzamanesi? Mari iyoyo inowanika here?
Mubvunzo wenyu atove mubvunzo munyowani. Mubvunzo wokutanga wanga uchitaura pamusana pemasaisai nekugona kubatana nevanhu vari kumamisha ikoko kumakliniki iwawo. Saka ndichazokupai nguva kuti mubvunze mubvunzo pakasiyana. Next question, sorry, is Honorable M. Gumede.
Ngiyabonga mphathishlalo ngethuba engilinikezweyo ukuthi ngibuze lami umbuzo wami namhlanje. Umbuzo wami uqondane lomnyango wezokusebenza komphakathi, lezabasebenzi kanye lezokuthuthuka kwenhlalakahle, i-Ministry of Public Service. Inanzelela ukuthi abantu bakithi abaningi ikakhulu akade bese South Africa sebephenduka njalo baletha imali eningi eyayisincedisa kakhulu njengelizwe, bencedisa njalo imuli zabo. Babethumela leyo mali emakhaya. Ngakho ngifisa ukuthi ngibuze umhlonitshwa ukuthi uhulumende ulazo na izinhlelo zokuncedisa laba ababuyayo, ukuthi one bathole imisebenzi kumbe bafundiswe imisebenzi yezandla loba amanye amakhono, kumbe bancediswe ukuqala amabhizinesi, kumbe baphinde futhi bathole imali yokuthi bawavule. Uminister angasipha na iziqiniseko zokuthi laba ababuyayo bazathola amathuba okwakha impilo zabo kutsha, basebenzise amakhono abavele belawo, njalo labo banikwe ithuba lokuthi baphathise ukuthuthukisa ilizwe, umnotho welizwe. Ngiyabonga.
Siyabonga, Honorable Gumede. The Minister of Public Service is not there, so the leader of government business, if you may respond on his behalf.
Ndoda kutenda mubato wechigaro nemubvunzo wakaisvonaka wekuti tine hama dzedu dziri kubva kunze kwenyika, ndezvipi zvingaitwe nehurumende kuvabatsira, ngari munyaya yekuita mabasa emaoko, kuvatsvagira mari dzekuti vange vachitanga mabhizimusi. Mubati wechigaro, hurumende yedu inokoshesa zvakanyanya mwana wemuno muZimbabwe akanga ataruda kudzoka kumusha. Haitarise kuti wakaita sei, kana ukatoda kudzoka kumusha, kana usingagone, usina zvekufambisa kubva kwaunenge uri, maembasi edu anobatsira. Zvinova izvo zviri kuitwa nehurumende kune avo vari kubva kuSouth Africa. Vari kubatsirwa netransport, votorwa vopinda. Kana vasvika munomu, kana uchibva kwaZvimba, uchibva kwaChirau, wonzi uri mubhuku rekupi, kana kune motika dzinokuendesa ikoko, woenda kumusha kwako. Kana wakumusha abva kuSouth Africa neari muno, vese vana veZimbabwe. Zvatinazvo zvinoshanda muno, kana tine Empower Bank, tine vocational training inogona, tine madhumena anoti, vese ivavo vakungoshanda vakatarisa mwana weZimbabwe. Ndo zvatiri kuita, tiri kutora vanhu vedu tovasvitsa mumusha mavo, toti kana une basa raunogona kuita, pane zvinogona kuti ubatsirike, zvinongobatsira vamwe vese, zvobva zvashanda pauri. Asi chatisiri kuita ndechekuregerera mhuri yemuZimbabwe kana ichida rubatsiro kuti umwe neumwe adzokere kubva kumusha kwake. Saka mabazi edu eCivil Protection Unit, vanenge vachisanganisira vehutano, manzwa minista vachitaura zvavari kuita kuti ukange wasvika kumusha, tochikurejista, tochitanga kukuita zvatunoita umwe munhu wega wega, kusikrina. Kana ari matesti, totoona kuti wapindwa muchirongwa. Kana uchida mapirisi eBP wapiwa, veagriculture wanyorwa. Kana uchida wopfumvudza bindu rako wakuita, ukauya muno mudhorobheni, kana une zvaunogona kuita, ukaenda kubhanga, wotopuhwa kana uchiqualify, kana uchikodzera muchivanhu chedu. Tinotenda mubato wechigaro.
Supplementary. Thank you, Honorable. Remember the rule. Don't switch on the mic so that it's orderly. Yes, Honorable Chidua.
Yeah, thank you, Honorable Speaker. I wanted to find out from the Honorable Minister. I know in diplomacy there is the policy of reciprocity. Our people were chased and they are being chased from South Africa. And in Zimbabwe at the moment we have got at least 25,000 South Africans. Don't you think in the spirit of diplomatic reciprocity there is a need for us to chase South Africans back to South Africa?
Order, order, order. 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 Order, honorable members, order. I will not allow that line of questioning in this house, Honorable Chidua. You don't tell me what to do. You are out of order. 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 We know our president is a president of engaging. And I will allow the minister to respond, but we do not, as a people, have that kind of attitude. as Zimbabweans. So we will not allow that. Honorable Minister, may you please...
Thank you very much, Mr. Speaker, for your kind response. I will just add, for purposes of ensuring that as a parliament we will not be misquoted. Mr. Speaker, as Zimbabweans, we are friends to everyone. Our culture dictates that if our children visit and they want to come back, we duly take them back. We do not have a policy of chasing away visitors. We have never had that. If you recall that His Excellency in 2021-2022, he even directed the Minister of Home Affairs to say that all those with national identity documents written alien, or all those that are undocumented, give them IDs. He even went further. I recall in cabinet, he said, if they don't have names, give them your surname, and all of them, let them be Kazembe. So we do not want to be what we are not, if I may say this. So we maintain our Ubuntu. We do not want to be dragged into borders that were created by people who are not us, and deny our relatives, whether they are in Zambia, Malawi, Botswana. We want to maintain this level that will accept everyone. So if we have our brothers and sisters coming from South Africa, we will accept them. If we have a South African who wants to come here and their papers are okay, we accept them. They are our brothers and sisters. I submit.
Thank you. Order. Thank you, Honorable Minister, for that clarification. And on that note, Honorable Karikoga, Honorable Tobaywa, stand guided, and next time don't try and direct the chair on how to control that. Honorable, yes, you can go ahead, Honorable Machoni.
Ndatenda mbato chigaro. Mubato chigaro ndoda kutenda mindo ya pakugurukota Honorable Siyambe. Asi Honorable Speaker, tirikuona vana vedu vachipindirwa mudzimba nguva dzeusiku vari kuSouth Africa. Vachirobwa vachitorwa property yavakanga vashanda panguva yakarebesa. Tirikuona vana vedu kuyangwa namapepa vachiharaswa, mapurisa akatarira, Mr. Speaker, sei. Ivo vane mapepa akakwana, asi mapurisa anenge aripo eSouth Africa akatarira vachitotarisa vana vedu vachiharasiwa. So tiri kudzoka chiti isu sehurumende hamugoni kungonyararawo zvavari kuitawo. Vana veZimbabwe voitawo basa ravo kuti zvifambe zvakanaka mativi ose. Ndatenda.
Aiwa, izvozvo hazvigoni. Minista vatsanangura ndambotaurawo futi zvakare kuti pachivanhu chedu ndo zvinhu wani zvatisingagoni kutombofa taita izvozvo, saka hatizoda kutangira ipapo. Honorable Masangu.
Supplementary. Thank you, Mr. Speaker, sir. Umbuzo wami ku question ebuzwe ngu Honorable Kumede uthi ku minister ngiyabonga ngempendulo yakhe, kodwa ke isicelo sethu ngesokuthi isituation yabantu laba abavele phandle kumbe eSouth Africa ayibuyanga ilungile. Bekungaba njani njengoba besazi ukuthi abanye sikhuluma kunje ababuyanga belencwadi zabo ezikwanileyo ezizabanika amandla ukuthi bahambe bayekweleda lezo mali thina esizikweledayo elizweni lethu, ngoba thina sivele sihlala sila, kodwa bona bebe out ababuyanga abalali belolutho. Kunganjani iministry ibe lesikhwama esokubancedisa ukuthi even beqalisa umsika kungabi lesanothi bahambe baye emabhenki ngoba sikhuluma kunje abanye vele kabala ndawo yokuthi bengathi kuthiwa bahlala la kodwa nxa engaphiwa something ukuthi aqalise ukwenza umsika or athengise anything kungakwanisa ukuthi kumvuse. Ngiyabonga.
Ngiyabonga, Honorable Minister.
Ndinotenda mbatho wechigaro. Chekutanga mbatho wechigaro. Vana vemuZimbabwe vari kudzoka. Hatisi kutarisa kana usina chitupa wakambotora chitupa tine nzira dzekuti tikupe chitupa nekuti chero imi muri muno munogona kurasa mapepa. Saka mwana wese wemuZimbabwe ari kudzoka tinomupa madocumentation muchirungu. Kana une vana vawakaitauri ikoko vasina mabirth certificate tiri kupa zvakare. Saka yezvitupa iri kugadziriswa. Kasi kana wane chitupa tochibvunza kuti kumushade kupi kana wanga uri wemuHarare usina pekugara aiwa vaEdgar Moyo tovati tine mhuri haina pekugara. Kasi kana uchibva kwaGore Dema kwaChirau toendazve kakumusha ikoko. Kana usina musha wekugara tine DDC nemakanzurari ikoko vochiita ka meeting yavo yecivil protection iya kuti pana auya uyu tochiita kuti agare sei mumusha voongorora kuti pane rubatsiro rungapuhwe here kuti anga achiwana pekugara ari mumusha make. Kana apinda mumusha mukati mevamwe ochishanda sevamwe, kana anga ane maskills akabva nawo akutibatsiraka. Isiri kutoona panike chirongwa chakatonakisa ichi nekuti vanhu vane maskill vakuya vachigadzira zvinhu zvekuti muchaona masumukiro achaita Zimbabwe. Saka tiri kuti tese ngativabatei nemaoko akanaka tivati mauya anogona kugadzira bhasikoro tochigadzira mabhasikoro edu afambe zvakanaka, anogadzira tractor ogadzira matractor, anogona kurima orima. Zvinoita kuti ikonomi yedu isibukire. Saka isusu hatisi kuona kushata kwazvo sehurumende, tiri kuona kuti vana vedu vadzoka kumusha. Uyezve isu hatimire paruvazhe kuti tinge tichikakavara nemuvakidzani. Saka pachivanhu pedu vanoziva shona zvinzi chakafukidza dzimba matenga. Kana muri mumba muchitaura hamuzoti kana mabuda imomo mochiratidza zvanga zviri imomo. Isu tiri paunhu hwedu hunoita kuti tiende mberi kwete kutsvaga gakava. Saka vari kuuya vakurudzirei kuti ngavauye vadzokere kunzvimbo dzavo kwavakabva vanobatsirwa vari kunzvimbo dzavo. Tinotenda mubato wechigaro.
Order. Honorable Minister, ndofunga mapotsa mubvunzo mbichana. Mubvunzo wavo wanga uchibvunza kuti sezvo vanhu ava vauya vanogona kunge vachitadza kuti vawane mari dzokutangisa mabhizimisi anofanira kunge misika nechichi. Saka Honorable Mahlangu vabvunza kuti ministry iyi haigoni kuita kachikwama kane mari ichazobatsira vanhu ivavo kuti vaite access mari yokuti vatange zvinhu zvavo ipapo. Ndofunga ndopanga pane mubvunzo mukuru ipapo.
Ndinotenda mubati wechigaro. Mubvunzo wavo ndaupindura. Mapinduriro andaita ndeyekuti hatisi kugadzira gwama revana vari kuuya, asi tiri kuti vana ngavaende mumisha. Kana ane project yaari kuda kuita ari kumusha, mapazi edu ehurumende aripo anobatsira uyo anga ari muno obatsira iye auya kuti vawane zvikwanisiro vakaenzana. hapana mwana ari kusarurwa kunzi uyu mwana anyanyisa kukosha kana kuti uyo haana kukosha. Tiri kuti vana ngavaende mumusha. Uyo anogona anove makanika ane unyanzvi akakwanisa kunge achirakidza kuti anokwanisa kuzoita bhizimisi achidzorera mari, vanoongorora nezvemari vakange vasapota anopiwa, asi haasi kupiwa nekuti abva joni, ari kupiwa nekuti anogona kuita basa racho. Tinotenda mubato wechigaro.
Supplementary.
Unfortunately, the supplementary questions
Point of privilege, Mr.
have reached
Speaker.
their limits.
Point of privilege, Mr. Speaker.
Yes, Honorable Kore.
Okay, thank you very much. Mashita, Mr. Speaker. Mibvunzo yabvunzwa, Mr. Speaker, maringe nevana vedu vari kudzokera. Ndofunga yaenda pazhinji pakutsvaga kuti voita sei zvikwanisiro. Asi yangu, Mr. Speaker, ndeyekuti hapanawo here zvingaitwa nebazi redu rehurumende kuti pavari kutoziva kuti minista vati hatikwanisi kupindira zviri kumusha kwedzimwe dzimba. Asi chikumbiro changu ndechekuti hapanawo here yatingafungidzira kuti kuwe nekutaurirwana pakati peZimbabwe neSouth Africa kuti pavari kubuda vana vedu ava zviitwewo zvine hunhu hwekuti mukatarisa vanhu vari kupisirwa dzimotikari, vamwe vari kuurayirwa vana. Saka Mr. Speaker, zvanga zvadii kuti iyo seSouth Africa vana ivavo vari kubuda kuuya kuZimbabwe zvongoitwawo zvisina zvinozokonzeresa mhirizhonga nekupwanyirwa kwezvinhu zvishoma zvavakashanda vari ikoko. Changu kungoti pangoitwa kakutaurirwana kwekuti hongu vana vari kubuda, asi madiiwo maita kuti zvingoitwa murunyararo, vauyewo vakakwana vaine zvishoma zvavakashandira, pane kuti zvavakashandira zvacho zviri kuparadzwa, kana ari mashops avari kushandira ari kutorwa zvavakatoshandira zvacho. Kungoita kakutaurirana ikako zviriwo peacefully.
Tatenda. Yangari point of privilege. I think Honorable Minister Manzwa chikumbiro chabuda chitorei mende nacho kumusoro ikoko moona kuti mochigadzisa sei. Next honorable member to take the floor is Honorable Mchemwa.
Tinotenda mubato wechigaro. Rega nitange nekutenda hurumende yeZimbabwe yakapa minda kumayouth, ikapa zvekumadzimai nevarwi verusununguko. Mubvunzo wangu woti hurumende ine urongwa hupi nekuchengetedza iwo mayouth edu nemadzimai vari kuita mahorticulture nezvimwe zvirimwa, nekuti mumaketi vari kukurirwa pamaprice pamitengo apa nemakoronyera anenge abva nezvinhu kunze kwenyika kwakaita sana Zambia neSouth Africa. Pane urongwa hupi hwekuti tiprotecte mafarmers edu kuitira kuti akwanise kufidha nyika yedu yeZimbabwe? Ndatenda.
Honorable Leader of Government Business.
Tinotenda mubato wechigaro. Mubato wechigaro, nguva nenguva tikange tichirima izvo zvinotikwanira, tinochinja mutemo kuti zvinhu zvinenge zvichipinda muno zvinopinda sei. Saka honorable member, kana vane zvirimwa zvavari kuziva kuti zvakawanda zvakanyanya asi zviri kubvumidzwa kuti zvinge zvichiunzwa kubva kune dzimwe nyika, vakauisa wakanyorwa vachitsetsemura kuti ichi neichi neichi, vebazi racho vana mazvikokota vanenge vane magwaro acho navanozoongorora kuti ndizvo here kuti tine matimati akawandisa asi ari kuuya, voisa zviga zvinoita kuti wedu wevhu wemuno anga achikwanisa kuenda kumariketi achinotengesa asingavhiringidzwe neavo vari kuuya nazvo kubva kune dzimwe nyika. Tinotenda mubato wechigaro.
Tinotenda. I don't see. Yes, Honorable Nyampinga.
Thank you, Mr. Speaker, sir. Ndoda kuwedzera ndichiitira kuti pamwe mhinduro yaminista ive neudzamu hunogona kubatsira isu tinobva kunzvimbo dzekuti takararama kusvika patiri apa nezvirimwa. Ndoda kupa muenzaniso wemadomasi mubato wechigaro. Nguva yemuchando ndoyataiziva kuti tinoitawo mari nokuti domasi mutengo waro unenge wakaita sei, unenge wakakwira. Asi ezvinezvi taangoti chando chikasvika domasi pacha raakubva kuZambia, chando chikasvika domasi pacha raakubva kuSouth Africa, vanhu vedu ndo vakutodzokera nebadomasi otonorasa kumba. Saka ipapo ngatoda kupanzwa kuti ari kumboingeiko madomasi ekuZambia muno mudomasi rizere. Domboshava yega inogona kuzaza nyika ino ichikwana nemadomasi.
Saka mimi muda kuti domasi ridhurire vanhu muite mari. Honorable Leader of Government Business, please respond.
Mubati wechigaro, ndo mhinduro yandapa yekuti zvatinoita polisi yedu ndeyekuti izvo zvatinogona kunge tichirima hatibvumire kana kupa import license. Kana kuti tikange tichaona kuti varimi vedu havachagona kunge vachienda kumariketi vachiwana mari nengari yekuti zvinhu zviri kubva kunze kwenyika, tinogona kugadzira kuti pazvinopinda zvinge zvichibhadhariswa mari yakati wandei kuitira kuti mutengo wemuno unge uchiratidza kuti unokwanisa kuti murimi wedu anga achiwana pundudzo. Saka ndanga ndati vanyore, nekuti ina handisi kuziva kuti kune madomasi ari kubva kuZambia. Asi vekubazi reagriculture vakanyora, vanoongorora, ndo basa ravanoita mazuva ese. Isu chandiri kutaura ipolisi yekuti tinozvienzanisa sei kuti hatine zvinhu here kana kuti hatina munyika. Kana tisina zvinhu, mukarangarira pane nguva yekuti takambenge tisina magosari akawanda, pane zvazvaitika. President vakati aiwa kune nzara, chero upfu ngauuye pasina maimport license. Zvinhu zvakuwanika, ndobva tadzokera pekuti tanga tisadaro. Saka ndiri kuti vakanyora, vebazi redu reagriculture vanonoongorora, vokwanisa kuchiita kuti tidzivirire varimi vedu, nekuti hatingadzivirire kamurimi wekuZambia tichirega kudzivirira wedu wekwamutoko. Tinotenda mubati wechigaro.
Tatenda.
Supplementary.
Yes.
Maitabasa.
Hold on. I think the Honorable Minister and Leader of Government Business is giving us a better way of tackling this issue by saying that let that question come in written form so that the responsible ministry can do a proper research and give us a quantified response so that we approach it holistically. So by virtue of that, I think there is no more any other supplementary that will arise from that. The next honorable member to take the floor is Honorable L. Mangwa.
Thank you, Mr. Speaker, sir. My question is directed to the Minister of Primary and Secondary Education, and in his absence, he's here. Thank you. A pronouncement was made that heritage-based education is now compulsory for all schools. My question, in line with schools already taking international exams in the form of Cambridge, is Cambridge being phased out? If yes, what is the roadmap? If no, is there an expectation that the students will do both examinations? I submit.
The Honorable Deputy Minister of Primary and Secondary Education.
Thank Thank you, Mr. Speaker. It is true that we are focusing on heritage-based curriculum. Cambridge exams, they are still being taken, but with the heritage-based curriculum. Seculars are still to go out. This is with the start of 2027, not the current sitting students. So yes, we are going on with Cambridge exams, but our main focus is the heritage-based curriculum examinations. So they are taking both. If you feel you want to go the Cambridge way, you still are taking the heritage-based curriculum exams. I so submit.
Supplementary?
Yes, Honorable Mangwa.
Thank you, Madam Minister, for the comprehensive response. Considering that the students are taking both, there's been a pronouncement to insist on local languages being part of what they should go through in terms of passes at O level. What happens to the contingent of students that may not have done indigenous languages at primary school level? Would they be at the same level to be examined with those that were taking it from grade 1?
Yes, the Honorable Deputy Minister.
Thank you, Mr. Speaker. I would like to say, for clarification purposes, yes, indigenous language, it is a must. That we have indigenous language in our heritage-based curriculum. So, if your student wasn't taking indigenous language from primary school, I've never heard of that. Here in Zimbabwe, we do have our 16 official indigenous languages, and they are everywhere. We are, the 6 of them, 9 of them are the ones that are being written exams on, and others we are still in process for them to be written. But it is a must that you have an indigenous language. Thank you.
Point of clarity.
Supplementary.
Yes, Honorable Gumede.
Thank you for the opportunity. My supplementary question to the Honorable Minister is whether the ministry has assessed the schools that are offering both the heritage-based and Cambridge. Will they have sufficient resources in terms of teachers, learning materials, and classrooms, and also the time to implement effectively both of these curriculums without compromising educational outcomes?
The Honorable Deputy Minister.
Thank you, Mr. Speaker. So here is the thing. Policy is we give priority to our own heritage-based curriculum. If you yourself decide that you are taking both curriculums, this is Cambridge and heritage curriculum, yes, we will come and assess. If you are qualified to write Cambridge on their own, they make assessment of the institutions that are offering Cambridge exams. And us as a ministry, heritage-based, our ZIMSEC, yes, we do assess if you are able to be able to manage the ZIMSEC exams. This is where we have our exam centers. So it is really up to you. if you are able to take both, but we are giving priority to our heritage-based curriculum. If it is compulsory. And it is up to you if you are able to take both. And the institutions that are offering Cambridge, they have already been offering Cambridge, and Cambridge has assessed them and certified them that their exams can be taken there. But in our schools, we are teaching heritage-based curriculum.
Thank you, Honorable Minister. Order. In terms of standing order number 68, time for question without notice is expired. So we move to questions with notice. Question number 1, Honorable Gumede.
Question number 1, Honorable Speaker.
Thank you, Honorable Minister of Justice. Do you have the answer? The answer to that? It's about pensioners and you want me to hold it off? All right, with your indulgence, Honorable Gumede, I'll go to question number 2, but as soon as the minister is ready, we'll have him respond to your question. Is that all right with you?
No.
It's not okay. He's looking at the responses and making sure that he does. It's a pertinent question, so we'll come back to it. I'm not saying that we won't come back. As soon as he's ready. So I'll move to question number 2, Honorable Mrombedzi.
Question number 2.
Yes, the Honorable Minister of Health.
Thank you, Mr. Speaker. Question number 2 from Honorable Mrombedzi.
Just hold on, Honorable Minister, order. Honorable Leader of Government Business. Do you mind approaching the chair, please, with me? Honorable Minister of Health, you may continue.
Thank you, Honorable Speaker. Question number 2 is to ask the Minister of Health and Child Care to supply the House with statistics on maternal and newborn deaths for the year 2025 and to disaggregate these province by province. Mr. Speaker, sir, I will start by saying the province, then the total number of deliveries in that province for the year, then the number of neonatal deaths, and lastly the number of maternal deaths, in that order. For Bulawayo Metropolitan Province, the total number of deliveries was 20,649, number of neonatal deaths was 624, and the number of maternal deaths was 61. Harare Metropolitan Province, total number of deliveries 84,756, number of neonatal deaths 2,205, number of maternal deaths 190. Manicaland Province, total number of deliveries 47,942, number of neonatal deaths 493, number of maternal deaths 53. Mashonaland Province, total number of deliveries 43,467, neonatal deaths 434, and number of maternal deaths 42. Mashonaland East Province, total number of deliveries 38,991, number of neonatal deaths 368, total number of maternal deaths 34. Midlands Province, number of deliveries 46,770, neonatal deaths 741, and maternal deaths 78. Matabeleland North Province, total number of deliveries 18,616, neonatal deaths 175, and maternal deaths 15. Matabeleland South Province, total number of deliveries 17,094, neonatal deaths 158, maternal deaths 16. Masvingo Province, total deliveries 37,483, number of neonatal deaths 385, number of maternal deaths 19. And finally, Mashonaland West Province, total number of deliveries 54,283, number of neonatal deaths 594, and maternal deaths 55. The total deliveries for the year 2025 is 410,051. Then total number of neonatal deaths for the whole year was 6,177. And number of maternal deaths was 563. I present, Honorable Speaker.
Thank you, Honorable Minister.
Supplement.
Yes, Honorable Romans, go ahead.
Thank you so much, Mr. Speaker, sir. And I'd like to thank the Honorable Minister for giving those statistics. My question, however, Mr. Speaker, having noted these provincial statistics on the maternal and newborn deaths for 2025, may the Honorable Minister outline what specific measures are being implemented to reduce these deaths going forward, particularly in scaling up emergency obstetric care, strengthening referral systems, as well as retaining skilled midwives in underserved provinces, and also the retraining of midwives. I so submit.
The Minister of Health.
Thank you, Mr. Speaker. I want to thank the Honorable Member for that supplementary question. Mr. Speaker, sir, we have a multi-pronged attack to this problem. Firstly, we deal with infrastructure and equipment. Secondly, we deal with health workforce. And then thirdly, we deal with the referral system. On infrastructure, we are rehabilitating our infrastructure, especially in the rural areas, from the clinic level to the district level. We have actually renovated most of our theaters, and then bringing in equipment. We have actually put in, over the last year, we put in more than 43 new anesthetic machines to enable our doctors in those district hospitals to perform cesarean sections to reduce maternal mortality and also to have improved outcomes of the neonates. We have also deployed neonatal resuscitators so that the newborns can be resuscitated as soon as they are delivered, and we have deployed them to number of our district hospitals. Wherever we've put in a new anesthetic equipment, we've also put a resuscitator. We have also been building mothers waiting shelters so that the mothers can wait at the clinic early enough rather than wait until they're in labor, because most of them face transport challenges. As a result, some of them deliver at home and some of them deliver whilst going to the health center, and the outcomes become poor. So these are some of the measures that we are taking in terms of infrastructure and equipment. On health workforce, we have increased our training, starting with the RGN intakes, which we have now doubled since 2023, and we continue opening new training schools. I'm sure some of you might have realized that in the last week there has been advert for intakes for only 3 nursing schools, one in Chimanda, then Gwanda, and then Mapisa. These are new intakes, and they will be adding new numbers to our intakes. That's why there were only 3. And then from January, they will join the rest of the training schools. We have also increased our midwifery intakes, and we have cut short the period from completing the RGN training to the period they are required or they are acceptable to take the midwifery courses. So we have reduced that by 1 year, from 2 years to 1 year, so that we accelerate the production of our skilled health workforce to deploy in all these areas. It is a long-term project to be able to reduce the maternal mortality and neonatal mortality. If you roughly look at the figures that are given you, when we report maternal deaths, we report per 100,000. So if you roughly divide 400,000 by 563, you can actually see that we have actually gone down from the 212, which was reported last year. It means we've done much better. We are improving. I present, Honorable Speaker.
Supplementary.
Thank you.
Supplementary.
Supplement.
Is that a supplementary over there?
Yes.
Yes, go ahead.
Mashita Mbato Chigata. Toda ngotenda minister
kuti tiite ma-outcomes akaonekwa nema-research kuti anobatsira. Naizvozvo ndiri kuti variko tinova-recognize vanoramba vachibatsirwa neruzivo rwokuti vanoita sei kumavillage kwavanenge vari, asi tiri kutraina ma-midwives kuti vawande, basa redu rigoita nyore, utano hwevana vedu nanamai hugovewo pamusoro. Ndatenda.
Supplementary.
Ndatenda. Yes, Honorable Poikil.
Thank you, Honorable Speaker. I would like to thank the Honorable Minister for giving us those statistics and also for...
Honorable Clerk, could you please approach the chair? Yes, you can go ahead, Honorable.
Thank you, Honorable Speaker. I would like to thank the Honorable Minister for giving us those statistics and also for coming up with the proposed solutions to reduce those deaths. But in this House, we'd like to appreciate if the Minister can highlight major causes of these deaths, because the Minister did not highlight major causes. We're in darkness. Thank you, Honorable Speaker.
Honorable Minister of Health.
Thank you, Mr. Speaker. For maternal mortality, the major cause of death is postpartum hemorrhage. But something which I must also mention is that
please switch off your mic, Honorable Kapwagile.
Institutional deaths. So it's also delay in seeking professional medical attention. Some of them delay getting to the appropriate institution where they can get help. So by the time they get there, it's a bit late, and at times late to save the mother, and also at times late to save the child. But in most cases, the mother can be saved through cesarean sections. That's why we have increased the facilities for cesarean section, and it may be too late to save the neonates. And for the neonates, the commonest cause is also birth asphyxia, where we say that they were, during birth, they got trapped in the birth canal, where they were now detached from the mother. The placenta has been detached, and yet at the same time, they are not able to breathe. So the neonate dies. So that is one of the major causes for the neonates. The second cause is also infection, especially neonatal infection. And in that case, we have always seen that the resuscitation part of it, when the neonate is born, has been lacking. So we are putting these resuscitators to be able to suck out secretions, which then clog the lungs to create these infections. And we also see infections in mothers, especially when mothers have tears or they have had delayed, they deliver at home, and they have had that delayed stage, or where the neonate passes stool in the abdomen, then we have these infections. So I think infections and birth asphyxia for the neonates, and then postpartum hemorrhage and infections for the mothers are the major causes. I thank you.
Thank you,
Supplementary.
Honorable Minister. Yes, Honorable Gore.
Thank you, Mr. Speaker. Mr. Speaker, my supplementary question, Mr. Speaker, is many expectant mothers reports they are being asked to pay for cesarean section, Mr. Speaker. Some cannot afford these costs, resulting in delay in receiving the care they need. What measures is the government taking to ensure that no mother is denied or delayed to access medical care, especially when they are due for the cesarean section? And Mr. Speaker, some cannot even afford to pay. And as the ministry assessed whether the issue of finances is also a barrier for contributing to the poor maternal and newborn health outcomes. Thank you, Mr. Speaker.
Thank you, Honorable Kare. Yes, Honorable Minister of Health.
Thank you, Mr. Speaker. I want to thank the Honorable Member for asking that question. Yes, it's true that at times access is difficult because of financial constraints. Mr. Speaker, as government, we'll be bringing in to this House the National Health Insurance Program scheme, which we are now terming the National Healthcare Provision Program. The draft bill is complete, and I've been communicating with our Minister of Legal Affairs here, and anytime soon, I think it will be discussed in the in the Cabinet Committee on Legislation, so that we'll be bringing it here. In that piece of legislation, government is coming up with free health care for every citizen of Zimbabwe and every resident of Zimbabwe. Funds will be collected in different ways, which I'm not going to go into detail now, and it is up to Parliament to be able to support that bill. The sooner it's passed in Parliament, the sooner it will be implemented, and it will reduce the out-of-pocket challenges. But as government, currently, we are paying all blood so that all women who need blood during delivery will have that blood supplied to them for free. And I want to thank government that so far they've been able to pay for the blood from the National Blood Service, and blood is available. At times when we have shortages of specific classes of blood, because it may not have been, they may not have been able to get enough quantities from the population. But that's one way we are trying to deal with those issues. Ideally, our policy is that no woman needing obstetric care should be charged money. But at times it's because the commodities that are needed may not be in the hospital, so the hospitals will end up charging for writing prescription for those commodities to be available. But as for the services, to say a woman will not have a cesarean section because she does not have money to pay for the procedures, that is not our policy. And should that happen, please let us know the institution, and if possible, including the name of patient, so that we make necessary interventions. I thank you.
Thank you, Honorable Minister of Health. Unfortunately, the number of supplementary questions is reached the limit. I think I'll ask the leader of government business so that we go back to the first question. Like you had indicated that you responded. But Honorable Gumede, I don't know how you wrote your question. Your question was not very clear on exactly what you're talking about. Someone would just guess, like I just guessed that you're talking about the issue of title deeds. But next time when you're drafting these questions, be specific as to what you are really referring to, so that there is no misinterpretation whatsoever. Honorable Leader of Government Business, please may I respond to question number one?
Thank you, Mr. Speaker. Mr. Speaker, this question appears to be appearing twice, where Honorable Gumede is asking me to tell the House whether the government intends to introduce flexible payment arrangements, installment plans or exemption for pensioners, persons with disability and low-income house owners participating in the validation and securitization exercise. And then B, what kind of public consultations were undertaken before the introduction of the program, and C, what mechanisms are available for citizens to lodge complaints, appeals, or disputes arising from the validation process. Mr. Speaker, let me start by giving a background. At the deeds office, we have a manual registration of title deeds. And what has been happening of late is that there have been fraudsters who have been colluding with some of our officials, changing title deeds, and then having home owners evicted from their homes. And some have actually, there's a case in Bulawayo where some law firm fraudulently obtained a title deed for a piece of land that was not theirs, advertised to people in the diaspora, who then bought in the mistaken belief that they were buying real land because they were actually showing them deeds. And in the end, it was then discovered that this was not their land. And the most famous one is that of the former cabinet minister, Dr. Mtumbuka, whose house was nearly sold because of those activities. Given this, we then undertook a research and we decided that let's computerize the deeds office so that we then have title deeds that are securitized. But how do we then decided to go about it? We felt that everyone owning a property in the title deed must go to their conveyancer. And that conveyancer, should anything happen, that becomes the responsible person that will hold accountable, so that we exclude those that may steal other people's title deeds. We didn't want a scenario where you walk in with your title deeds and then you do the verification alone. It may happen that after some time someone will come and say that I never tendered my title deed. But the whole thrust is that all the title deeds in the country must be securitized. We want to remove this fraudulent activity and connivance that were happening where honest people have lost their properties. So we decided to go the route of using a professional who would then do the verification and tender those documents. And because he's a professional registered by the Law Society, we then hold that individual accountable. So the monies that are charged is purely consultation fees to the lawyers. We are not, as deeds, getting all that money. So this process, to answer the first question, I will answer it in a manner that our late Minister of Agriculture, Parents Shiri, may his soul rest in peace. He said at one point when addressing farmers, they were complaining that they didn't have chemicals for dipping cattle. Their cattle were dying. What was government doing because they were indigent? And he said, the loss is to yourselves. It's better to sell one cow and you contribute as a team to procuring these chemicals, and you save 5 cattle. If you have 5, sell 1, and you preserve 4. This question whereby the honorable member is saying they want flexible, they want exemption. The point is, this exercise is benefiting the title deed holder, because we are putting mechanisms to ensure that what may happen now, because this question is presupposing that what happened to Mtumbuka or to those diasporans who were sold land will not happen to the disabled or to the pensioner. So we are saying what can be negotiated is the quantum, but this process is a very noble process that will secure property for everyone. Because once it's securitized and the verification has been done. The burden now lies with the conveyancer should anything happen. And all the homeowners will now be protected because we will now have a computerized system that will tell us exactly who accessed the system and authorized the transfer. So these questions, even the public consultation, this is for the benefit of the public. There was a public outcry which is well documented, and there is no need to continue with a public consultation over a process that is protecting the very individuals, including all of us here. You may fall prey to somebody who can manipulate the system as it is currently. So even on the question of mechanisms to lodge complaints, we are saying go to your conveyancer. So I'm not sure what complaint, because you are going to your lawyer, or if you do not have, government has a legal aid directorate who do means test to say there's this program that is being done, but I'm an indigent person. They will do a means test to see whether you are unable to pay or not. But what I'm appealing to honorable members is there have been so much misinformation about this. This is a very good program that we put safeguards to ensure that we protect properties for all of us by migrating from a paper-based system of title deeds production to one which is a computer-based, which is securitized. We will even have links to banks, whereby if somebody is selling a property and you go to a bank, the bank will have a user code that will access our system and be able to view and satisfy themselves that this is authentic. But right now, you may actually visit the deeds office looking for a copy of your deed. You may not get it. So this is a process that has been that has not been clearly understood by the majority of the people, and I can see from the questioning that the questions believe that government is benefiting from this, believe that it's an unfair system, but this is a people-driven process because of the outcries from those that have lost their properties. I submit, Honorable.
Thank you, Honorable Minister. Yes, Honorable Gumede.
Thank you so much for the comprehensive response that the Honorable Minister has given us, highlighting the fact that as legislators, our responsibility is to convey what is on the ground. My supplementary question, therefore, is that if this digitalization of title deeds is a government initiative, first of all, I believe that the principles of good governance guide us to say that there should have been public consultations. And secondly, why I didn't quite get why the citizens are expected to pay the $215 US. Yes, they do benefit, but can the government not allocate some kind of budgetary support so that they can be able to fund this program? This, to me, is actually a plea to the minister to say that yes, the 215, it sounds reasonable to say you are protecting maybe a property of 60,000, but still the 215 is not affordable. So can there not be ways that this 215 can strike a balance from what the people are saying on the ground and the good work that the government is trying to do with this program? Thank you.
Thank you, Honorable Gumede. Maybe to ease that, because the Honorable Minister, believe me, this subject of title deeds and all that we're talking about here is very contentious out there. Is there probably a way that maybe you as a ministry you give us a proper direction in terms of a written statement to say the process that the people are supposed to go through is A, B, C, D. Because now there's a lot of misinterpretation, false information, so many information that is flowing around. People no longer know what is happening. You are told that you are supposed to pay $250. You are told that you are supposed to pay $210 somewhere. So maybe, can you, as a ministry, give us a comprehensive way of how this thing is supposed to happen from A up to Z, so that then from there we can be guided and know? Because it's a question that were asked by our people from our constituencies. I was asked that question yesterday at 9 p.m. to say, Honorable MP, what is happening? Why are we now paying all this money when we think? So please, is it possible to probably give us a comprehensive statement on the whole process?
Thank you, Honorable Speaker. Honorable Speaker, firstly, let me just respond to indicate that I comprehensively responded and indicated that we had a problem of fraudulently produced production of title deeds, and that does not require a public consultation, and it has nothing to do with the so-called good governance. It's clearly a criminal process that was happening due to the issuance of deeds that were fraud to duplication in connivance with other people. So as a government, you don't wait to say, I'm going to do a public consultation on whether to put a system that will secure your property. Just like the example that I gave you, that government put deep tanks and they make sure they provide dipping chemicals to protect the head. And then somebody says, we need a public consultation on whether we need to have our head protected. This is a system that is protecting our property. As a government, when we put measures, we even compel the ignorant so that they are protected. That is the reason that when you have programs like immunization programs that they do, I was told that my young son needs to go and have, my grandson needs to go and have cholera vaccination and polio vaccination. And they indicated that it was ending on Friday. There is no need for public consultation. The minister will simply direct that we need to eradicate cholera. And these are the measures that we are putting to ensure that it's eradicated. The point that I'm putting, Honorable Speaker, is that we have politicized a system that is protecting ourselves. But the danger as a government is to allow the ignorant to say, I don't want. Because when you lose property, you then have to go to the same legal system, our police and the courts, to report, and it will be the burden of the state again. What I am saying is we actually negotiate.
On a point of order, Mr. Speaker.
Yes, what's your point of order?
Mr. Speaker, you, despite that you made a ruling, we expected the minister to, number one, comply with your ruling. Number two, to consider also the wisdom that can be found in the people they assume they are ignorant. What is happening with title deeds? I want to give examples. One example. There are people who are now staying in the houses that they inherited from their fathers. Some are now maybe 99 years old. And those are the people who are no longer working, Mr. Speaker said. And the idea now is that how then that person needs to be protected.
And even the idea of public consultation cannot be substituted because there was a problem. Even if there is a problem, a public consultation is a constitutional requirement because this is a program that will require people to pay. So those who are not able to pay, ministers cannot simplify and take the property owners as homogeneous. If you go, Mr. Speaker, to Kwabobo or to Harare South,
Can you keep it short?
Yes, I'm finishing. I just want to end by saying, if you go to areas where this issue of title deed started, like Kwabobo, Hopli in Harare South, Heathcliff, those areas, Mr. Speaker said, the people in those areas, they struggle even to get $10. So these are the people who would be expected to pay $200, more than $200. We need those safety nets. I humbly request the Honorable Minister to listen and to consider that there is also wisdom even in those sharks in Hopli. That's our plea, Mr. There is wisdom there.
Thank you, Honorable.
Yes.
And a point of clarity.
Order. Can we allow the Honorable Minister to finish off first, and then we take it from there? You may continue.
Thank you, Honorable Speaker. Honorable Speaker, Honorable Mahama never listened to what I was saying because hopefully it does not have title deeds. It's a totally different scheme altogether. We are trying to give them title deeds. We have different schemes. We have a presidential title deeds program where we are saying those vulnerable people that are staying in houses without title deeds, they need to have title deeds. Then we are saying you are holding a title deed and you are vulnerable because there are people who are manipulating those paper-based title deeds. And we are having a process of converting those into securitized, computerized, more secure deeds. So those are two different programs. And I am saying the process of conversion, we actually had to negotiate with the Law Society. We had an option of saying all Zimbabweans with title deeds, you walk into deeds office and present your title deeds. But we felt it was extremely dangerous because thieves can actually steal and connive and change those deeds. And the true owners would then emerge when we have already changed. Then we said, let's use conveyancers because these are professional lawyers that we can hold accountable should they process a deed and verify a deed fraudulently. So what we can only negotiate is how do we assist those that are indigent so that they can also have their title deeds changed. That's where I said we also have the Legal Aid Directorate that do a means test for those indigent. And then I gave a scenario to say that this is a process that is helping all of us because we are vulnerable to fraudsters. Some of us may believe that what happened to Mtumbuka cannot happen to you. And that is false. It can happen to you while you are crying out that I don't have $200. You may lose a property that is worth more than $15,000, $20,000. So that's where we are saying this is a very good program. The question is, perhaps, like what Honorable Gumed is, those that are indigent are the ones that we can then refer to our Legal Aid Directorate so that they can screen and be satisfied and then process. Because there may be cases where genuinely they can't. They are not even able to feed themselves. Perhaps social welfare is taking care of them. Then it means that it's the same government that is feeding them that should also do likewise. But we are saying this process does not need all that Honorable Gumede was saying, because it's real. I agree, Honorable. We have already started having programs on radio. My permanent secretary has issued a statement, has been on First the Nation. We can prepare a comprehensive statement that we can circulate to show the gravity. But all I'm saying is, those terms that you were given by Ramnangagwa, if you get deeds for them, you are vulnerable to the fraudsters if we continue with the system that we have currently. That's the reason why we want to change to a more secure, that will give comfort to our citizens. But let's not confuse this process with the presidential title deed program, where we are going to areas where people do not have title deeds. And we are saying we need now to verify and identify the actual owners and come up with a scheme that will be incorporated into the rates so that they end up with their title deeds and be able to access, be it infrastructure bond collectively to do the roads and other infrastructure. That is a separate program. But this one is for those that have title deeds, that have property which has a certain value. I submit, Mr. Speaker.
Supplementary.
On a point of clarity.
I will prepare something for honorable members as you directed, but I felt that I needed to clarify why this program is there for honorable members to have an appreciation, but I will duly comply with what you submitted, Mr. Speaker. Said.
Thank you very much, Honorable Minister.
So
I think because the Minister has agreed to give us a statement, a comprehensive statement, maybe let's wait for that. By next week, I'm sure it will be there. Then we'll stand guided as to what exactly the process is. And if there is any clarification, we can do the clarifications then.
On a point of privilege.
For now.
Point of privilege.
Mr. Speaker, sir, on a point of privilege.
Order. Please, all take your seats. Take your seats. Wonderful. Right. I was saying that the Minister has clarified what is clarified. And he has even agreed to do a ministerial statement. So I don't know what points of privileges you want to rise on. But okay, I'll indulge you. Yes, Honorable Gumede starts.
Thank you, Mr. Speaker, sir, for indulging me. My point of privilege was just to request humbly so to the Minister to say that there are aspects of this program which are very complicated and they are confusing to the public out there. I was requesting that as you write the ministerial statement or a comprehensive statement, can you clearly state what happens at the end where the deadline comes and lapses? What happens to the people who would not have digitalized their title deeds? I think people really want to know about the deadline issue because the deadline is quite close. Thank you so much.
Honorable Masangun, what do you want to clarify as well?
It's not clarity per se. My plea to the Honorable Minister is to extend the validation period to the 31st of December 2030. The reason why I'm saying that is just because we want to align this project with our vision 2030, whereby we're going to reduce the panic from the people and those agencies that might want to do academic programs. I thank you.
Right, is Honorable. It's Honorable.
Sagandira.
Yes, Sagandira, yes.
Thank you. My request, Honorable Speaker, is that the ministry seems to be doing very well in terms of employing digital rights management system. But the ministry seems to be turning a blind eye on other property rights management, like the rights of musicians. This system is not benefiting intellectual property rights for musicians. They are not able to get their subscriptions.
I think you're now out of...
I'm just requesting the minister to...
No. I was indulging you, but we're actually out of the thing, because I wanted the minister to be prepared for the comprehensive statement that we had asked for. So what I indulged on was to say, what do you need to be included in that statement? That is why I allowed Honorable Gumede.
Yes, that's why I'm saying of
but
the
now we are talking
intellectual
about
property rights for musicians, which is the same office.
No, please bring that separately, not on this one. Thank you. Order, just hold on, order. Right, the last one on this, Honorable Madzanyiga.
Natenda
and keep it short.
Sure. But kumbira kuti minister pawachana nemhinduro panyaya yezvematitle deed iyi vaonewo because vanhu vedu vakushauku vari kutaura kuti ini sababa wako mwanangu pandakaona matitle deed aya ndakabhadhara conveyance yakutaura iyoyo ndikabhadhara zvose zvaidiwa nebepa randaroora kudhara iroro saka iko zvino moti ndibhadhara zvimwe mari haisi double jokwadi iri mwanangu yati vazopinjirawo pabora voya nemhinduro yawo paministry of settlement yawo natenda
tatenda. So, Honorable Minister of Justice, I think you've heard... So, I think we're done because we have got a lot of other questions. I'd indulged people on this, but the Minister has heard the jinx and the trajectory of how he is going to respond to this.
If you can indulge me, yours truly.
30 seconds.
Majida, thank you so much, Honorable. Thank you very much for granting me this opportunity. Honorable Speaker, I just wanted to hint the Honorable Minister. Honorable Minister Ziambi, Leader of Government Business, if you may pay your attention. Please, Honorable Ziambi.
Honorable, I said 30 seconds and you're going round and round.
If you realize, Kuti, the former minister Dzingai Mtumbuka akabirwa imba yake nenyaya dzematitle deeds. Ndinokumbira kuti Honorable Minister pauri kuva nestatement vaite so thara kutarisa magap ese kuitira kuti vabatsire vanhu vari kunze uko vari kukanganiswa. Ndakaona vamwe mai dzimai wa the late Brigadier General vakatorerwa imba yavo nesim system yevanhu ivavo. Saka tokumbira kuti minister pavanouya ngavatibatsire kuti kana yese iye inoshandiswa ngemaguruvha uko zvibatsire kuti zvinhu izvi zvimire vanhu vabatsirike. Mazvita.
Thank you.
Maona kuti zvine musoro zvinoda kutaura ka.
Minister ndo zvavatanga nazvo izvozvo vichitaura kuti chirongwa ichi chakakoshera nyaya idzodzo dzokuti vanhu vanga vakubirwa and kunyanya magweta anga kushanda pamwe chete nevanhu vanoshanda ku-deeds office vechiita izvozvo. Saka ndofunga Honorable Minister mazvinzwa muchatigadzirira nezvizere panyaya iyi nekuti nyaya iri kushungurudza vanhu vakawanda kuno muZimbabwe. Next question number 3, Honorable Bajila.
Question number 3, Mr. Speaker.
The Minister of Health.
Thank you, Mr. Speaker, sir. Honorable Bajila's question is to ask the Minister of Health and Child Care to inform the House on whether any studies or data exist regarding the prevalence of developmental and growth disorders among children born to parents who received COVID-19 vaccination, and to clarify the Ministry's position on any established relationship, if any, between COVID-19 vaccination and such disorders. Thank you, Honorable Bajila. As a ministry, we have not received any such reports or any concerns regarding this. We have not received any data on any changes to the prevalence of growth or developmental disorders post-COVID-19 vaccination. Let me take this opportunity to inform the House that the Medicines Control Authority of Zimbabwe, which is a parastatal under the ministry, has an arm which looks at adverse events following vaccines. They are the ones mandated to perform surveillance on any ill effects regarding vaccines administered. To this end, they have no such reports. I present, Honorable Speaker.
Thank you, Honorable Minister.
Supplementary.
Is there a supplementary?
Yes, there is a supplementary.
Yebo.
Yebo, equal.
Uzayifaka nje njengoba besithi abana lutho abalutholile. Alright, go ahead, let's hear.
Okay. Thank you, Mr. Speaker. I would like to thank the Minister for the response. What I wanted to check was if they have managed to have conversations with the Ministry of Primary and Secondary Education, from the sense that while no reports have been brought to them, whether there could be those kinds of thoughts and observations from the side of the Ministry of Primary and Secondary Education amongst growth and development issues with these ECD learners at this juncture, because parents who bring these issues to us have their learners, have their children starting ECD now, and they sense that there are growth and development issues amongst their children, and the responses that they are getting perhaps straight from the clinics may not be satisfactory to them. Has the ministry had conversations with their counterpart in the primary and secondary education to ascertain that these issues do not exist at all?
Honorable Minister of Health.
Mr. Speaker, sir, this is why I say there's MCAZ, which does follow up on such issues and does surveillance, and they have not reported anything to the ministry. We as ministry, we take cases which are reported to us, and then we start the follow-up. We have not had any cases of developmental abnormalities. These are theoretical things that we have read, that there could be higher chances. In fact, they say 16% higher chances of neurodevelopmental abnormalities. But we are saying, as Zimbabwe, we have not had any reports to that effect.
Thank you, Honorable Minister. So maybe, Honorable Bajila, you probably need to have those parents that are experiencing that approaching the ministry or the body. You said it's MCZ, Honorable Minister of Health? You said the body is what? MCZ?
So Speaker, sir, it's called Medicines Control Authority of Zimbabwe, MCAZ.
Oh, MCAZ. Yes. So, Honorable Bajila, maybe you are better off referring those affected people to that body, so that if ever there's any issues, they can arise from the research from there. Question number 4, Honorable Madzivanika.
Question number 4.
The Honorable Minister of Health.
Thank you, Mr. Speaker, sir. Let me thank Honorable Madzivanika for his question, which he says the Minister of Health and Child Care to inform the House the measures being taken to urgently address the grievances of striking nurses across the country. Mr. Speaker, sir, the government carried out a payroll analysis to urgently address any technical glitches that may have occurred during the transition from the previous remuneration framework to the current one, developed for implementing the new grades from the job evaluation exercise. Some of these glitches may have resulted in the disaffection expressed by the nurses. The government is further evaluating a submission made by the health workers to increase health-specific and risk allowances applicable to health workers according to prevailing economic conditions and available fiscal space. Further engagements to consider the workers' position will be addressed through the best negotiated package, that is BNP, a platform for negotiations between the employer and health workers. Government is committed to addressing legitimate concerns by its valuable employees who should engage the employer in a lawful manner through the established frameworks. I present, Mr. Speaker, sir.
Thank you, Honorable Minister. Yes, Honorable Mazwanyika.
Thank you, Mr. Speaker. Mr. Speaker, takaona vanamukoti vedu vazhinji vachichema zvichomo zvokuti transport yavo pakagadzigasa itwa transport allowance kombi yaita 50 cents kubva kwavanogara kupinda muguta. So iko zvino chichemo chavakanga vachichema pavairatidzira vaiti no kombi yavakuita dhora iko zvino tipedzerewo. Saka ndina kunzwisa minista kuti vatsanangura zvakadipo zvichemo zvamanesi zvavana mukoti zvanga zviri pachena, zvanga zviri zvinhu zvainzwisika neinstitution tiri kurama nayo. So ndinoda kuziva kuti honorable minister pane urongwa hwakaita here kubetserawo zvinhu zvakasiyana transport zvakanga zvakwira zvichasa transport allowance nezvipo zvavanga vachichema nazvo. Ndangomba somenzaniswa. Ndatenda honorable speaker.
Honorable Minister.
Thank you, Mr. Speaker. I think discussions are in progress. Proposals have been made, and the first proposals of allowances that were made were adjusted, and now we await the new proposals, because when we have new proposals which are discussed between the Health Service Commission and the health workers, are then put together and presented to the Minister of Labour and Social Welfare, who in turn will present them to the Minister of Finance. And I think that's the stage where we are now, for the Ministry of Labour and Social Welfare to have the discussions with the Minister of Finance, with the comprehensive list now of allowances, which were last reviewed in 2022. And the Minister of Finance were happy to have discussions around the new proposals. And that's what we are waiting the results.
Thank you, Honorable Minister. Order. In terms of standing order number 68, time for questions and notice is expired. The Honorable Deputy Chief Whip.
Good evening, Mr. Speaker, sir. I move that the House do not adjourn.
Who seconds?
I second, Mr. Speaker, sir.
It has been moved that the House do now adjourn. Is there any debate? I put the question that the House do now adjourn. Those who have that opinion will say aye. Those of the contrary opinion will say no. I think the ayes have it. The ayes have it. The question is accordingly affirmed, and the House is adjourned. To what day, Honorable Deputy Chief Whip?
To Tuesday next week, Mr. Speaker, sir.
The House is adjourned to Tuesday next week. Thank you and have a good night.